Jessica, thanks for joining me today and having us down to your amazing gallery space. Today we want to learn a little bit about art therapy and how that might relate to OCD or anxiety disorders in general.
So how I got involved a little bit was my own art making and realizing that art was not so much about the product of art, but the process itself. Seeing the joy that people get out of making art, going through struggles, is really something beautiful, and I wanted to really follow that. So yeah, there's a big gap with mental health issues today, and really no one should be facing that alone.
Can you tell us a little bit more about art therapy? What is it? How does it work?
So it really is kind of accessing parts of the brain that are tough to bring out in psychotherapy and traditional talk therapy. So for somebody who doesn't quite know how to verbalize what they're feeling, it certainly opens up the doors to allow that to happen through the creative process. Art therapy is setting goals and being in a safe space with a trained professional.
It's really about the process, not the outcome.
Absolutely.
So for someone who maybe is not a professional artist, it's really investing their time in going through the process and learning from it. I've read that art therapy works well with anxiety disorders. OCD is an anxiety disorder. How does someone suffering from anxiety benefit from art therapy?
The process of art itself and creating in general, that flow that you kind of reach, that catharsis, that release, is meditative. So you get into this state of creation with materials that allow you to be focused solely on creating and not other thoughts or other worries. Just getting those thoughts out, getting those images out, that stress out. It's definitely a cathartic release in that way. It also acts as a way to cope. You use a controlled material like a marker where you can't erase it. That mark's already down on the paper or the canvas. You tell yourself you made a mistake, but it's about adapting and kind of going with the flow of it. So if you're able to do that in an artistic process, you're able then to adapt in real life. An art therapist might ask a client or patient to draw an intrusive thought, and that's kind of a form of exposing them to that fear or that thought and just kind of working through that process, but allowing too that maybe that frustration of those thoughts to let that come out with the art materials physically. So really getting it out and moving on from it. And
Assigning no value to it, basically.
Yeah, assigning no value.
Personally, as a sufferer of OCD, I found a lot of therapy through making music, working in a creative agency, having a sense of community. Can you tell us a little bit about group art therapy?
Just overall being surrounded by others that you can relate to and can also relate to you is huge in getting through anything or dealing with intrusive thoughts. You're just more prone to open up to the people that understand you. Art is a universal language. Everybody has that within them somehow, that creative process and that creativity. You can visit arttherapy.org and to find an art therapist in your area. And also, most importantly, because everyone's different, talk to your doctor about what treatment might work for you the best.